Can you afford to be wrong about your health? I am talking to you, the person who has worked hard, saved your money, and is now looking at retirement or already living it. You think you're covered because you have that red, white, and blue Medicare card in your wallet, right? You think, I've paid into the system, I'm safe. But I am here to tell you that what you don't know about Medicare can, and will, cost you thousands of dollars if you are not careful. We are talking about the three things that often fail us first as we age: our teeth, our eyes, and our ears. Does Medicare cover dental, vision, and hearing? The truth is a no that should make you sit up straight. In 2026, Original Medicare, that's Part A and Part B, still considers your teeth, your eyes, and your ears routine. Can you imagine that? As if being able to chew your food, see the road, or hear your grandchildren is a luxury. It is not a luxury, it is a necessity for a quality life. But the government doesn't see it that way. If you walk into a dentist's office for a cleaning, or an optometrist for a pair of glasses, or an audiologist because you can't hear the television, and you hand them your Original Medicare card, they are going to hand it right back to you and ask for your credit card. Now, don't get paralyzed by fear, because fear leads to bad decisions. We need to look at the facts. Under Original Medicare, there are almost zero provisions for routine care. No cleanings, no fillings, no dentures. No eye exams for glasses, no frames, no contacts. No hearing aids, and let me tell you, a good pair of hearing aids can cost you $5,000 or more. That is money coming straight out of your retirement savings. Are there exceptions? Yes, but they are narrow. Medicare will cover dental work if it is inextricably linked to a medical procedure. If you need a tooth pulled because you're getting a kidney transplant or heart valve surgery, Medicare might step in. For vision, they will cover cataract surgery, thank goodness, and they'll even give you one pair of glasses afterward. They'll cover an eye exam if you have diabetes or a high risk for glaucoma. For hearing, they might pay for a diagnostic exam if your doctor orders it to see if there's a medical issue, but they will not pay for the device that actually helps you hear. So, what is the solution? Because you cannot just sit there and let your health deteriorate. You have two main paths, and you need to choose the one that gives you the most security. Path number 1, Medicare Advantage, also known as Part C. About 54% of you are already on these plans. Private insurance companies like Aetna, Humana, or United Healthcare run these, and because they want your business, they bundle in extra benefits. In 2026, almost 98% of these plans offer some form of dental, vision, and hearing coverage. Often, it's a $0 premium on top of your Part B. It sounds like a dream, doesn't it? But listen to me, you must read the fine print. These plans usually have allowances. They might give you $1,500 a year for dental. What happens if you need a $3,000 bridge? You are on the hook for the rest. And remember, with Advantage, you are often tied to a network. If your favorite dentist isn't in that network, you're paying out of pocket anyway. Path number 2, standalone insurance or Medigap riders. If you want to keep Original Medicare because you want the freedom to see any doctor in the country, which I love for you, then you have to be responsible for the gaps. You can buy a standalone dental, vision, and hearing (DVH) policy. They usually run between $30 and $50 a month. Is it an extra cost? Yes. But it is a predictable cost. I would much rather see you pay $40 a month than get hit with a $4,000 bill for a root canal and a crown when you're 75 years old and living on a fixed income. You have to be a master of your own money. Do not wait until your tooth hurts or your vision blurs to figure this out. If you are in the open enrollment period, or if you are just turning 65, you need to look at your health history. If you know you have soft teeth or a family history of hearing loss, an Original Medicare plan without a supplement is a recipe for a financial disaster. Check your evidence of coverage if you're on a Medicare Advantage plan. See exactly what that dental benefit covers. Is it just cleanings? Or does it cover the big stuff like extractions and root canals? If it doesn't, you need to save an emergency fund specifically for these costs. I want you to have 3 to 5 years of living expenses in cash, but I also want you to have a health cushion. The truth is, the system has a hole in it. But now that you know where the hole is, you don't have to fall into it. Be proactive. Get the extra coverage if you need it, or build the savings to cover the hit. Your self-worth is tied to how well you take care of yourself, and that includes your ability to see, hear, and smile. With that said, thanks for watching, and until next time.